And shifting focus to across the pond, junior doctors in Britain began a 4-day strike over low wages, stating that their morale is at an all-time low. Tens of thousands of junior doctors, which includes qualified physicians who make up nearly half of the medical workforce, staged a walkout. This comes after a 3-day doctor strike last month. The strike is likely to cause unprecedented disruption, prompting the government to raise the alarm on patient safety. The British Medical Association wants a 35% pay rise, arguing that members have suffered a 26% pay cut over 15 years. The Sunak government has called the demand unfeasible. Now let's listen in to the voices from the ground.
The morale is at an all-time low. I don't remember the last time I went home and felt like I've done a wonderful job, everyone's got the care they wanted, the care they deserved. I don't remember a time I've gone off shift and felt like I had energy for anything left. We're just all running on empty, emotionally, physically. It's a dire situation, but still we all struggled with a question, despite that, of going on strike, because we love our patients at the end of the day. We want to be there for them and we want to give them the best care. I mean, I'm only 4 years post-graduation, but there's already been suicides from my graduating class. I've got friends who've left medicine because it's broken them. I had to have counselling for PTSD symptoms after the COVID pandemic, because it was a horror, and we're still expected to carry on as though nothing's happened, and deteriorating conditions, and it's getting to the point where we're all at breaking point, not just financially but mentally and physically. We just can't go on like this.
For me, is that we're often covering big gaps in the rotas. I spent half my day apologising to patients for their appointments being postponed, for their operations being delayed, for the fact that they've had to wait 10 hours in A&E and then they come up to the general surgical triage unit and they wait another 10 hours. And I feel awful, because if I was in their position, I would be angry too. They're not getting the care they signed up for, the care that they were promised, the care that they should be getting. And that's because there's not enough doctors on the ground to treat them. Our doctors are leaving to Australia, Canada, New Zealand, other industries where they feel they can provide better care and they can have their salary doubled. We're not asking for that. All we're asking for is to get back to net neutral, just back to 2008 levels, where the service ran more efficiently, when the waiting list was a third of what it was today, and when doctors were being paid a slightly more appropriate wage.
I do. I'm a midwife. I'm in the profession as well, and I work with the doctors, and I see how hard they work and how much they commit their time, and sometimes nobody, they deserve it. Absolutely deserve it. Please, they do. Let's keep our doctors. Let's keep our NHS.
Deeply regret these strikes, and in particular the timing, which have been timed deliberately coming straight after Easter. The fact that the BMA junior doctors have asked their members not to tell NHS managers whether they intended to go on strike or not, making contingency planning more difficult, and also their refusal to agree any national exemptions. Other health unions, like the Royal College of Nurses, agreed national exemptions, particularly, for example, for cancer patients, so that those patients weren't impacted. The Junior Doctors Committee has refused any national exemptions, and obviously that puts patients at greater risk. But we're working very hard to mitigate those impacts. I had a call again with NHS England. Well, we want to reach a fair and reasonable settlement with junior doctors. We recognise the hugely important role that they play within the NHS. That's why we stand ready to have meaningful and constructive talks with them, as we have had with other health unions, as we have in terms of responding at the budget to concerns from doctors regarding their pensions. So we are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors, is not fair or reasonable, and that is why we've not been able to make progress so far. But we want to engage constructively. We recognise junior doctors have been under significant pressure, particularly from the pandemic, and we want to work with them to find a fair and reasonable settlement. Well, a huge amount of effort is going in to mitigate the impact of the strikes, to ensure that emergency cover is there. The clear message to the public is, for those who need the NHS will be there in terms of responding to urgent calls, but to be mindful of the demands that they place on the NHS. But a huge amount of effort has gone into the contingency plan, the measures in place given the effects of the strikes, but clearly they've been timed to have an impact on patients, and I think that's very regrettable.
Fair or reasonable is the pitch that's coming in from the British government as the junior doctors continue their protest. I'm joined by CNN News 18 Sanjay Suri from London. Sanjay, what's the latest?
It's the turn of the junior doctors now in Britain to go on strike, and this is the second industrial action that they've taken. A 4-day strike now underway, and they are demanding a 35% increase in pay that the government has said it cannot afford and will not pay. Senior doctors, consultants are now stepping in because the junior doctors have said that they will not carry out emergency procedures. The junior doctors say that in effect over the last many years they've seen a 26% reduction in buying power from their money, given the inflation rising steadily over the last many years and particularly sharply of late. The junior doctors are on two slabs of income. Under one, a junior doctor will start on an income of £30,000 a year or so in the first year, going up to 34 in the second year. Under another older scheme, the pay would be about £25,000 in the first year, rising up to £30,000 in the second year. And they say this simply is not enough. And they are now on strike and joining a number of others who have been on strike, and others, in fact, planning further industrial action and strikes to demand more. This is a particular strain on the Sunak government. Politically, they do not want to look bad in this pre-election year. The Conservatives really have their backs to the wall, and despite several successes in policy decisions from Prime Minister Sunak, the Conservatives are trailing behind Labour. They want to be popular, they want to get these decisions right by public mood, but they say they have no money. They are trying also, Rishi Sunak particularly is keen to balance the books and not go further into the red. The Sunak government has refused the kind of hike that the doctors are demanding. They have refused also hikes that others have demanded. There have been some compromise agreements at a small level. The government with doctors is talking about a 5% increase on top of 5% last year. The doctors say that is not enough. So it's a question for the Sunak government between balancing the books, declaring a policy that they can follow consistently with others demanding more pay, because they couldn't possibly pay the doctors a lot more and refuse money to others on strike and who isn't on strike. So it's a difficult question for the Sunak government to tackle, a difficult decision for the Sunak government to take.